Hello, everybody, and welcome to the first edition of Conversations and Aesthetic Podcast Live. We're coming to you from Winter Clinical Miami, this beautiful hotel with amazing weather. And I have my great friend, Todd Schlesinger, who's going to be our guest today. Todd, thank you so much for
I can't believe this is the first one.
Here.
I didn't know that.
Well, it's the first live one. We've done a few episodes that are on dermsquare.com.
Yeah.
But this is the first one we're doing live, so I'm so happy that you are
I'm honored to be
the
here.
guest today. So why don't you take like a minute and tell people a little bit about yourself, your practice, what you do, what you like to do, things like that.
Sure, yeah, Todd Schlesinger, I'm a dermatologist in Charleston, South Carolina. I trained at Cleveland Clinic, undergraduate at medical school in Buffalo. Worked for another doctor for about 7 years and started my own practice in 2005. Always did research. All the way through from Cleveland Clinic, all the way did research, started out doing early trials and always did lasers, always kept involved with all that stuff and did Mohs surgery for many, many years. And then I started my own practice, ran it for 19 years. During that time, started a research company, do a lot of that kind of work as well, always done studies. And then I transitioned out of the practice in 2024 into private equity group, kept all the rest of it, kept the research. And so, I think that in my practice, I really kind of do a lot of different things like many dermatologists do. You can find me doing aesthetics and injectables and lasers as much as you can find me treating advanced skin cancer patients, which I really enjoy as well. So, I like to do a lot of things.
You're like a renaissance man of dermatology.
Dermatology is really everything. Cleveland Clinic, I think, gave me good training because we did a lot of aesthetics, we did a lot of medical, we did research. So I think that was really what got me into not just pigeonholing into one area.
And I think that's what attracts a lot of people to dermatology is the fact that you can, cut out a melanoma and then your next patient is going to be botulinum toxin injections and fillers, and then you're going to do a skin cancer screening. There's a lot of variety, so I think it's really great. And something, Todd and I met well over, 15 years ago. We connected over a legal case, and we're experts. We're experts. And then you actually came up because I needed to be, quote unquote, trained to use Belafil. This is
like
a long time ago.
Trained, but
I needed to be trained to check off a box, and Todd
Yep.
came, and we had a great time.
Yeah.
So yeah, it was great. So what is aesthetics? What does that mean to you personally? And how do you think it's evolved since you've started doing it 20 plus years ago?
Well, of course, in 20 plus years, when I was starting out, I was there kind of in my time starting out was when, Botox became cosmetic. We were starting with collagen-based fillers, Zyderm, Zyplast, Cosmoderm, Cosmoblast, and we got Restylane. That's kind of where, that's when I started. So we have so many products, so many devices that have come out. So aesthetics to me means a difference you can see and feel. It's a model we developed for our practice, we've always used, and it kind of just portrays that the patients are coming in, they're spending money, they're looking to see something, but they also want to feel good about themselves. So it's really two things. So I think that portends into not overdoing things, treating patients well, and at the same time, they need to have a good experience.
So I love that because when patients come and ask me, well, doctor, what do you think I need? I always say, well, nobody needs anything. No one needs to do aesthetics. And you're doing it for yourself because you want to feel better. You want to look better. You're not doing it for somebody else. It's not an external reward. It's an internal reward. And I think what you touched on is very important because we've gone from overfilling, overcorrecting, everyone looking kind of weird, to now we just finished an injection session and everybody wants to enhance their natural beauty and just look the best they can for their age. I think the idea that you can look 10 years younger with one syringe of Restylane is just flawed.
I think it is a less is more theory to a point, but I think it's important to be honest with our patients about what things that can benefit them. They may come in with extreme volume loss and say, "Hey, doc, what can I do for $500?" Right?
Yeah.
And then you got
100%.
those patients probably need surgery, and then you've got the realistic patient, at the middle, who comes in and actually honestly wants to know what you have to say. Listens, and we have a nice dialogue. Those are the patients I like to treat. I like to treat people who I like. So those patients are great.
Self-selection.
2 to 4, self-selection. Yeah, we've been in practice for a while.
Yep.
I think I call it a private practice for a reason, which means treat the people who
you don't have to treat everybody,
no.
And not everybody. You don't have to be everybody's dermatologist, and not everyone has to be your patient.
Absolutely.
100%. I think what you said with a severe weight loss, I really think that GLPs are going to drive aesthetics for decades. I mean, we're seeing volume loss in the face and body. We're seeing hair loss driven by GLPs. Patients are, most people may not know this, but most weight loss with GLPs is visceral fat. So people are becoming skinny fat. They still have, subcutaneous fat they want to get rid of, but they are, they feel better, so they want to look better. So I think what you said is right on point. I think that kind of GLP face is, Ozempic face is a real thing, and I think it's just going to drive aesthetics up, 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 up.
Yeah, it's kind of like what happened when we first got, when HIV came around, we had nothing to do for it. We had that volume loss, right? I do agree with you. I think we're learning more and more every day about GLPs and their effects. I mean, they have some great central effects as far as, people feeling good, more focused, sleeping better, maybe they can do more things. The weight loss is part of it, but I completely agree that you still have subcutaneous fat that people want to deal with, so you can offer body sculpting to those patients. We have very safe combined heat-based electromagnetic treatments now that work excellent for that. And then I think the most important thing I think people that are taking GLPs should think about is the rate and speed of their weight loss, because it's, is it the GLP or is it just the speed of the loss, which drives telogen effluvium, which we're comfortable managing in the clinic?
Yeah, it's probably both. There was a study just published recently. It was an Israeli study that showed that, the reason the hair loss happens, for example, is A, rapid weight loss, B, you probably have some nutritional deficiencies, and C, especially in female patients where I see it the most, is there's probably hormonal abnormalities that are, or I shouldn't say abnormalities, they're more like imbalances that are caused by GLP. So again, I think that's right on the point. So you did mention something about your consultation. So I'm a patient, I come to see you in your beautiful office in Charleston, South Carolina. Tell me what that looks like for you. Somebody comes in, they want a cosmetic consult. What do you talk about? What's your approach?
I think I think the approach is try to be holistic. First of all, I ask for input from the patient. What
don't you like about yourself? There's
well, I mean, there's
right?
that. There's the TV show question, but then there's also the, what have you learned? What are you interested in? So that kind of open-ended question helps me like that. Well, doc, they don't know. The toughest thing is like you had mentioned, to tell a patient. You don't want to, but sometimes you kind of want to say, so what I try to do is if the patient comes in and they really don't know, I'll always be positive. Well, we could do this, we could do that.
Mm-hmm.
We have a range of different things we do. We have
to correct, enhance.
We have fillers and lasers. We want to make people look beautiful, or look great for where they are. What are your goals? So I try to start with that, and then I think once I've got that dialogue open, then I can start to have a conversation about, well, we have these things. We can offer a neuromodulator to do this. We can offer a filler here and do this, and I may show them a few things just by moving. I maybe give them a mirror and use my fingers to show them, hey, this is some movement. What do you think of this? If they react positively, I say, okay, maybe this is the direction we should go in. Things like that. I do use before and after pictures as well to try to give them some ideas. So I really try to encourage the information to come from the patient to me, as opposed to me telling them, because I think no matter what I tell them, it's not going to be right.
It's very interesting because I trained in the South. I trained in Wake Forest. So you have like a very southern approach. It's very gentle. Whereas in New York, I tell my patients, I say, look, I'm going to be honest with you. If you don't like it, I'm sorry. Yeah. I give them a mirror and say, this is the list of things that I see.
That's what I recommend.
And this is what we can do to correct them. And then it's like a menu. It's an a la carte menu.
Yeah.
You can choose whatever bothers you about those things, and things we can correct. It's like going,
I think it comes very much into the area.
For sure.
When I'm in New York, I do turn a little bit of a New Yorker sometimes, but I go back south, I got to get,
You're a little bit more gentle and mild. I love that. What do you think? So what do you think the ideal of beauty, if such a thing exists? What does that look like to you when a patient, let's say somebody comes in first time, they're going to do some laser toxin filler. What is the ideal of beauty that you're trying to give them? What does that look like for you?
I think it's a really hard question, like what's ideal, because everyone has their own beauty. I think men and women, I think there's stylized sort of images of what we think is beautiful. There's measures, that we look at, okay, is this measurement of the lip and the structure of the face is of course with a wonderful aesthetic, but in reality.
The golden ratio, of course.
Golden ratio, the phi ratio. But I think that in the end, the beauty is what makes the patient happy. So, I think if it comes down to it, of course, if you're going to look at some structural things, the golden ratio is one thing. That triangular sort of look in the female a little bit, where you have a nice contoured jawline, nice contoured cheeks, things like this, smooth and flat forehead and glabella, and lack of
No
lateral canthal
pigmentation.
lines, even skin
Beautiful
tone,
skin tone,
and
yeah.
things like that. For male, I think the structured jaw, the forward jaw, it's kind of a little bit of an inline, between the nose, the lips, and the chin is a sort of a handsome male look. But it's
For men,
really
it is
the whole
different.
picture. It is different. It's really different.
20% of my cosmetic patients are men, and I see a lot of men walking around that have been feminized, unless they want to be feminized.
Right.
But they, I think a lot of doctors give the same correction to men and women, and I think that's just completely
Absolutely,
wrong.
totally different.
You have, I always say that I'm going to make you look Clint Eastwood-esque. That kind of rugged,
Yeah.
strong chin,
You
strong
gotta have the jawline,
strong cheekbones, flat eyebrow, maybe more wrinkles and lines than you would in a female patient. Whereas, I think most women prefer a softer correction. And there are some people that I think everyone would agree that they're beautiful, regardless of who you ask, and then the rest of us mere mortals just want to look the best we can for
That's really
life.
about, it's just looking good and feeling good. I think it's number one. So I don't think there's any one clear answer, and every patient probably has their own thing, but of course there's measures that we use.
And I do love the fact that you talk about feeling good, because that comes from outside, but also comes from inside. So all of my patients I talk to about nutrition, hydration, exercise, it is a holistic approach, because you can make somebody look better, but they're still miserable and unhealthy. They're still not going to be happy with
It's a
whatever
luxury,
result.
discretionary
That's exactly
purchase.
right.
So if you don't feel good about it, it's probably not the thing for you.
It's the experience. I love that you said that, because I use that all the time. I love that. So what do you think some of the misconceptions, somebody comes in and sees you for the first time, what are some of the misconceptions that you hear a lot of patients tell you that you like to address when you do that consult?
I think the misconception is that everything can be fixed in one visit. I know that you could do combination treatments at one time, but I think patients have
it's a journey.
An expectation.
We're going to go on a journey
right?
together.
I think now that we have exactly, I think it's a great thing to say. I also think now that we have AI, we have a misconception that we can look like that. And so I'm not sure if you've had this, but I've had plenty of patients come to me with pictures on their phones that I clearly say are AI. And of course, I recognize that right away, and you're showing me an AI picture. So I think that the AI,
Well, like an actor or an
social
actress,
media,
it's just unrealistic.
Yeah, it's created this unrealistic image in patients' minds of what things should look like. So I think that's, if you're asking when people come in and they just have unrealistic expectations, unfortunately, the social media piece has driven that quite heavily, especially in the younger people.
I 100% agree. I think social media is like one of the best things to happen for us as aesthetic doctors, and one of the worst things, because it's driven more and more patients to the specialty,
Right. Yeah.
But it's also made people a little crazy about expectations.
Right.
Because some of it is unrealistic.
And you forget, I think if you're scrolling through social media, you forget
No one
how
looks like that in
altered
real
the
life.
pictures
That's
are.
right.
Yeah, you got to
Nobody-
remember that.
I think Zoom and social media have really driven so many patients, because I remember during the pandemic, and even now so many people do video calls, people would come in and say, I had never realized that I look like this.
Yeah, because
I
you're
had
looking
a
at yourself
different-
in the screen.
Most people have a different image of what they look like in their brain, and then they're, I think most of the time, I think Zoom actually did the study because they track your eye movement.
Yeah.
Over 80% of the time, people look at themselves when they're on those video calls.
Yeah,
They're not looking at
I
anyone
have
else.
my picture in the middle, and I just don't. I put the slides in the bottom right.
It's very smart. It's very smart. Big, you blow yourself
Oh,
up.
I have in the middle. Yeah, the slides are off the screen.
like
yeah.
it. I
Put them
like
in the second monitor behind me.
I like it. So you have like one of those trader
yeah.
desk with
Yeah,
two
it's behind
monitors.
me. Yeah, I can't even see it.
Oh, that's funny. So I know we want to talk about lip filler, because that's one of the things that you love to do.
Yeah.
So tell me your approach specifically to lip filler. What products do you like to use? What technique do you use? Do you numb? How do you numb? So somebody comes in for lips. What does that approach look like to you?
So, I just have in my mind that, like you mentioned the golden ratio, I sort of have that in my mind because I think that's, the beautiful lips have the contour, a little bit more lower lip. Of course, that does vary by ethnicity. You got to be careful of that because ethnicity, big difference if you're treating a different group population. But to me, lips have beautiful edges, they have beautiful contour, fullness, a nice surface that's not dry, free of scale, things like this. I mean, beautiful appearance to the lips. So my approach is, and I do use in the videos, I do show needle and cannula. I really can do both with both. Those videos came from an anatomy lecture I did. So the first thing I'm always thinking about is anatomy, just in my mind when I'm teaching about that.
So remind people of the anatomy.
Yeah.
What's important to not get into?
Okay, so basically what you've got is you've got the facial artery, which is surrounding the lips on both sides. You have the inferior and superior and inferior labial arteries, which enter in from the sides. There's a lot of variability in the anatomy. So typically, we've learned through ultrasound images, confocal microscopy, histology, kind of where those vessels lie. But of course, there's a lot of variability, right? I tend to be mostly a needle person. So
Same.
my approach to the lips is going to be to create a nice border to start with. Again, that depends on the page of the patient. Then I'll go back in and I'll actually individually manage the philtral columns, the Cupid's bow individually, manage that from both sides. I definitely want to make sure my patients don't have, the classic duck lips, so I'll taper off the filler on each side so it looks beautiful as it tapers off on
Thank
each
God
side
that
bone.
trend is over.
Yeah, that's over. So I'm coming in from the lateral approach and coming in from a little bit further in from the edge and doing both sides, and then I'll come and do the volume after. And the volume will be putting just points of filler basically just underneath the skin. So we're talking about small aliquots and then massage into place. Looks beautiful. And my plane of injection primarily is going to be sub-Q, not really into the muscle. It's going to be in the sub-Q plane, and that's mass, mostly dermal plane, which is what we do now. It allows me not to use that much filler. As far as the numbing process goes, it's usually just cool pack. Sometimes I don't like to do a lot of topical anesthesia before, things like that, because I think it distorts the anatomy. So I do a little cool pack, keep the patients in good, get them comfortable. But the vast majority of them tolerate it, which is perfectly fine.
You ever do dental
I've done
blocks?
dental blocks with what I sometimes will do with those. If I have patients a little nervous, is I'll take basically a Botox syringe, and I'll use a 31 gauge needle,
So
like a magic
syringe.
needle, and do a little, or even it's finer. The TSK, they make a magic needle, which is 32, and then I'll do just a drop of numbing is all you need in the right spot. You can get enough that you need. I don't like to do a lot. I want to see the anatomy.
What is your favorite product for lips, and does it vary? Do you use different products from patient to patient, or do you just grab whatever you have in your cabinet?
No, I do. I mean, probably the one I'm using the most is Restylane Refine.
Okay.
I use some Kiss as well. I have found that I've gravitated a little bit more to the Restylane line of products because in the Refine and Define, but for the lips is the Refine. Reason why is I can do a lot with that. So I can take that one syringe and I can treat the lips with needle or cannula, mostly needle, and I can actually go back and get some fine lines. If I need to, I can also hit the oral commissures a little bit with whatever I have left over. So oftentimes I'm using just one syringe. And I can not only treat the lips, but have enough left over to touch up a few areas around it with one. If I have a patient who needs more volume, it may be two, because I may be treating fine lines as well. So I try to treat not just the lips themselves, but I try to treat that area holistically as well, and try to hit those fine lip lines.
So what is an average volume of filler that you would say use for a lip correction?
Usually I do one syringe.
A full syringe?
Oh yeah,
So
well I mean not
cc.
all of it in the lips though. Like I'll say I'll sometimes have
see.
some left over. In some patients who need more volume, then I may
use
use
a full
close to the whole syringe.
Yeah.
But I oftentimes have a little bit left over. In a young patient, I may have half a syringe left over when I'm done.
So what is the youngest patient that you've done lips on?
But the youngest people I typically do it are in the 20s.
20s?
Yeah, I don't really, I mean, not that I wouldn't treat somebody younger, but a lot of times the people that come to me, of course, as I'm aging, my audience is aging a little bit.
Yes.
So, South Carolina, I've got a lot of older folks that come in. But the patients of the youngest group are going to be in their 20s, and that's kind of when they get introduced. And I would say that group are the ones that are going to look to the lips first. That's going to be the first thing that they want to treat, because they don't really have any volume loss in the cheeks at all, but they want a little bit of enhancement centrally. And I think that comes also from what they see online.
And I agree with that 100%. I think there were some psychology studies that show that when people talk to somebody or they meet them, the first place they look is their eyes, and the second place is their mouth.
When they've also done the visual studies looking at
Correct.
where people look, like you had mentioned as well. It's
It's
really you're looking.
it's the center of the face.
center of your face.
So I think that's why I think having treating crow's feet, making sure that there's no volume loss underneath the eyes, making sure the eyes are nicely framed by high cheekbones and having beautiful lips. I think those are all things that are very important. And that's something that you can do without spending a ton of money and getting really a good result. And I think a lot of patients, that's probably all they need, maybe.
I believe in neuromodulator early because the results are good.
I like pre-tox. Are you a pre-tox guy? Yeah,
100%.
I love pre-tox. I think that's the way to do it.
Yeah.
I think that's, waiting for wrinkles to set in and then trying to smooth them out is the wrong way.
Then you got to go to laser. Microneedling RF or laser.
Or a facelift. I see patients younger and younger getting lifts, and that's just crazy. Women in their 30s getting a facelift.
Well, there's a variety of lifts you could do now. So
I know there really is.
Yeah.
So somebody comes in, they do the lips. What do you counsel them with Refine? I'm a mostly Juvederm person, but I like Refine also, and I've used Kiss many times. I like Volbella personally because it's thin. So for me, it gives a more natural and sort of more quote unquote kissable lip because it feels more natural.
You use plenty of it.
Yeah. So what do you tell them? How long is it going to last? How often do they need to get it done? All those things.
I think that in my hands, the Refine has a little advantage in longevity.
It is longevity.
The reason why I like it also is because of the elasticity of it. It kind of moves well with the tissue. So I'll tell them these fillers are rated for a year, but it's variable. Now, some people, I've actually told patients that in some cases the HAs are lasting longer than we thought they would, especially in certain areas. But I think for lips, I think a reasonable thing to tell a patient is 6 months to a year. I don't want them to have an expectation it's going to be longer than a year, but I tell them they're rated for about a year and the results are variable. So 6 months to a year is fair. They usually come in 6 months.
I say 6 months also. If it lasts them for longer,
it's
then
bonus.
You look like a winner. And if it's
don't
6 months,
overpromise.
That's
true.
Right. You never want to
Yep.
You always want to underpromise and overdeliver. You never want to do the opposite. And I think lips are one thing that I'll do in somebody who's maybe 18. If they really have thin lips and they want, it's going to make them feel better about how they look, I think that's appropriate.
I think it's fine.
Yeah, I do too.
I mean, it's safe,
I do. Well,
the only thing almost
it is a higher risk area, and the lips, you really, we talked about, sort of
safe in our hands.
Yeah. Well, look, I worry about everything.
Yeah.
When I'm injecting somebody, I always worry, right? Because once you start becoming cavaliers, when you get into trouble,
never become
right?
cavalier.
So I think lips are one of the higher risk areas, and patients need to be aware of potential complications. So one of the things I like about your technique is you're always moving your needle. It doesn't protect you 100%, but it's the least. It gives you the best chance of not getting into a vessel.
You kind of have one eye on the injection site, maybe one eye in the syringe to see the volume, and then you have your smart hand there as well, just making sure your needle is in the right spot. So I do believe in the smart hand piece as well.
I do too. I think it's a two-hand technique. Yeah,
absolutely.
For sure. Okay, so we're going to do something new today that we have not done on any of the prior podcasts, Todd. So I hope you're excited.
So are you ready?
About
Is
this.
this,
I'm going to put you in the hot seat. Okay. So I'm going to give you a series of questions, and I just need quick 1, 2, 3 answers from you.
Okay.
It's the first thing that comes to mind, and it's not tuberculosis. That's a Seinfeld reference.
Okay. Soup to nuts.
Yeah, that's right. So the first question is this: what is your favorite cosmetic procedure that you perform?
I would say neuromodulators.
We're like two peas in a pod. I agree. I think botulinum toxin is revolutionary.
Yeah. It's easy. Patients are.
Well, it's not. I wouldn't say it's easy, because a lot of people mess it up. You see people with one eyebrow's here, the other one's there. It's easy until there's a problem.
True. In our hands, usually, most of the time.
Well, you have to ease into it. I think that's what you meant.
Yeah,
ease into it. That's it.
Okay.
Okay. What, in your opinion, what is the most overrated cosmetic procedure patients request?
Probably, I would say some of the body sculpting procedures are overrated.
100% agreed. Okay. If you need to lose 20 pounds, cool sculpting is sculpture.
What do I get if I get these answers right?
There is a prize at the end.
Okay.
It's off air, though.
Off air, okay.
All right. Next question. Aside from sunscreen, what is your hero skincare ingredient?
Retinoid.
3 for 3. I love it. We're the same. I think retinoids are highly underrated. I think people are not using enough. What do you think?
Anti-inflammatory, epithelial improvement, Anti-aging, you can't go wrong with a retinoid as long as
Pigmentation. Clearly helps with skin normalization for patients who have sun damage, AKs, et cetera.
Absolutely. And you've got to make sure you pair it with sunscreen.
Sunscreen in the morning, retinoid at night. So
It's a starter.
It's a starter. It's your gateway.
We have so much data on that.
Troves. I mean, if you're not using retinoids, you're not optimizing your skincare.
Yeah,
routine.
and everything else builds on that.
You know, the funny thing is, I just thought of this. You know, I do a skincare consultation on every single patient that I see in the office, and it just blows my mind that so many of our colleagues neglect skincare, the most basic thing that patients do day in and day out for their skin.
I think a lot of that comes from just so much information coming from all directions on that. So I think that there's been some articles published. Our group published an article on acne-ceuticals, really just speaking about how to complement what the patients are doing in prescription-wise with topical skincare as well. I think there needs to be a lot of clarification, but since there's so many companies producing so many products and touting so many ingredients without data, that I think it comes, mind-numbing, and people just freeze. They don't want to do it.
That's the reason why we have to own the space.
That's right.
That's the reason why we should do a consultation, talk to the patients, and explain to them. And look, I like a simplified skincare routine.
Sure.
You need a cleanser, you need a sunscreen, you need a moisturizer, and retinoid. With just those 4 basic ingredients, you're there like 99%.
And I start the question, I just start the conversation by, what do you use on your skin?
I love it. Favorite toxin?
Still Onco, Botox.
You can use brand names, it's okay.
Botox.
Yeah, Botox, okay, good. Favorite filler?
Restylane Define.
Restylane Define.
Yeah.
If you could live with one filler product, Restylane Define?
Only one?
Think of the old days when we only had one.
I can do a lot with Restylane Define.
I like it.
I could even do, if I had to, I could do lips with it.
Yeah, you could do it. For me, it's either Ultra or Restylane L. Just plain old, like, basic OG kind of products.
Okay, all right. I mean, at least you know what, it gives you a lot of variety if you want to do.
You can do anything with it.
You can do anything
for
with it.
sure. All right. What is the most often used laser device in your practice that you use?
The V-beam. Yeah, the pulse dye
Vascular
laser. Pulse dye, yeah.
Yeah, I use KTP, so same
idea.
Same idea. Okay. Salmon sperm, real or hype?
I think it's still hype.
Maybe a little bit of both.
I mean, I think there's data, but
Yeah, a little data.
I mean, I think.
Are you doing it or no?
I'm topically.
You're doing it topically?
Yeah.
Using K-Beauty products? What are you using?
Well, there's some new things coming out from L'Oreal too.
But they're not out
The
yet.
K-Beauty, I did a lecture on K-Beauty just at MCAS recently, and it's interesting what that, K-Beauty's got a very interesting whole history.
It's very quick.
It's very quick.
turnover.
It's all been driven by the Korean wave concept, with the media and everything rides the wave. But it's really also very new because it really all came after the North and South Korea separation. Is that you had this increase, but there was one company in Korea that was doing all the skincare for a long time, and now it's blown up. But it has been since the 90s and forward is the K-Beauty wave.
I'm fascinated by K-Beauty.
Me too. It's interesting.
It's like H&M. Like they make a line,
It's
when
low
it sells
cost.
out, it goes away. Then you make another line.
Yeah, it's low cost, so it's very accessible. But it's become a huge sensation in the United States. It's overtaken in many cases
driven by social
the French.
media.
Yeah,
it's free
for
advertising. So I think I already asked you this, but let me just recap. The youngest patient you've ever done a cosmetic procedure on?
I don't remember exactly, but I would say close to 20.
20, okay, good. What is the youngest patient that you've ever sent for a facelift? Because I assume you have a plastic surgeon you work with.
Yeah, but not like in my office.
Not in your office, but you refer out to.
The one I've sent for a facelift, I would say it would be high 40s, young 50s.
High 40s.
Yeah, I'm not sending. I mean, I wouldn't like send somebody that's younger. If they come and ask me, I'd say look around. But
it's interesting because I've sent 30-year-olds because they've lost like 100 pounds and they really need.
You know what? I'm not seeing those. I mean, I don't think maybe the GLP thing is a little different in South Carolina. I'm not seeing the patients who have gone like crazy overboard with the GLPs. Of course, we have people who are using them, but maybe in New York it's just a little different population.
I think
people
every
really
one of my
wild
patients
with
is taking a GLP.
Yeah, we're using it, but it's just not.
Are you prescribing it?
I don't prescribe it.
I've done it. I prescribe it for patients. It's so easy. They go, with Lilly Direct. It's really inexpensive.
I think our company. I asked about it. I think our company. It's now a big company that we don't have it in our
It's not on your purview.
proctoscope thing. I'm not sure about that, so I need to look into it more.
Fair enough.
Yeah.
All right, last question, and you're off the hot seat, okay? If money is not an object, what would be your ultimate anti-aging treatment or routine?
It's laser resurfacing for sure.
What do you use for that?
Cynosure CO2.
I love CO2.
Yeah.
It's making a comeback.
CO2
For a while, nobody wanted to do CO2. Now I'm doing more CO2.
I do
than
CO2
ever.
all the time. The CO2 is great because you can do a minimal treatment, or you can do a very intense with the same laser. So we can really vary it all the way up. So if you come in and you want to have a refresher peel and you're younger, we could do a CO2. If you come in and you've got severe sun damage and wrinkles and your skin's real thin, we can do a CO2. So we can do it for a wide variety of things with the same laser.
I like turning it up to 11.
Yeah, that's it. That's it.
Do you use any regenerative
When the lights
treatments
dim,
after-
when the lights in the office are
That's
dimming,
right.
then we're good. Then we know.
Do you ever use any regenerative treatments with CO2, like PRP
We use
or
exosomes.
exosomes?
Yeah, adipose stem cell derived exosomes we use after.
Do you use them right after, or do you make them come back?
No, we use them. Well, there's been some new discussion about that. So we've always traditionally used them right after, but there's been some new data that's come out that's speaking about, maybe we should give the skin a break and let the fibroblasts recover before we add another, thing to them and force them to do more work. So I think there's a lot more information coming about the senescence and about the activity of fibroblasts, and not to, overtax them either. So I do think. And I feel I'd be migrating a little bit more, because normally I'd mix an exosome solution, we'd apply it after treatment, and then give them some to take home for which works great.
Yeah.
But the question would have worked better if we waited a week or two.
Looking back to how CO2 worked, sort of the original explanation, is I always feel like you need that inflammation. If you take away too much of that inflammatory response, they're not going to get such a great result. So I usually make them wait 1 to 2 weeks, and I just do mesotherapy with PRP. It's inexpensive, and it's very safe. And I think that's worked very well. Well, this is very exciting, Todd.
Yeah, it's been great. Thank you.
I'm so happy you were able to come and be our
It's
guest
my
in
pleasure.
Conversations in
First
Aesthetics.
one live.
Thank you so much.
Thanks for
thank you,
having me.
everybody. Thank you. We have a live audience. Thank you, live audience. And thank you, everybody, for listening. Don't forget, you can find all of our podcasts on dermsquare.com. Thanks until next time.